Welcome back. As we approach the busy holiday season, it can be hard to remember what's really important in life, like your health. We're talking today about stroke and vascular disease. It's a leading cause of death in the United States, but many times it goes undetected until a serious medical complication occurs. And that's why we have Dr. Roger Wolcott here from Catholic Health today to tell us about taking the necessary precautions to take care of our health this holiday season. It's a busy time of year and people may forget to take a break and think about their health.
Have to do it. Some key things that we try to do, but maybe you should try to do more of. Exercise is always important every day. Try to get out, and especially for
every day. It's hard to do it every day.
Right? But for especially folks who maybe
if we miss a day, it's okay, right?
a little bit. Not quite as young anymore, they need to be walking every day. And, if it's half an hour, if it's 45 minutes, that's great, either at the mall or if it's nice out outside.
I was going to say, I heard the average person walks many miles just doing their holiday shopping each year. So you can get that right out of the way, right?
Absolutely.
What about some other things?
You really want to try to a little bit watch what you eat, and as always, that's important. But I would say, a regular checkup. If you haven't seen your family doctor or your internist if it's been 6 months, if it's been a year, now's the time to think about maybe I should come in, get my blood sugar checked, get my cholesterol checked, because those are the kinds of things that are going to impact our vascular health. As we go forward.
And we're talking today about vascular health. Like you said, you have a screening coming up this weekend. We'll get to that in just a second. What kind of people would you like to target to take care of their vascular health this holiday season?
I think the people that we think about when we think about vascular problems like carotid artery disease and aneurysm disease are folks who maybe they're currently smoking, or they've done a great job quitting, but they smoked in the past. People with diabetes, those are probably the two categories who are at the highest risk. And then also folks, it's usually disease of people probably over 50, over 55. So if it's not you, maybe it's your mom, your dad, an aunt or uncle, something like that.
And like we said before, these things often you're not aware that you even have an issue like this until something bad happens. So that's why you encourage regular screening. Correct.
And that's the great thing about Catholic Health is at least 3 times a year we're doing a screening looking for these kinds of things. So, often undetected, and we want to prevent stroke, we want to prevent vascular problems before they come up.
All right, and you have one coming up tomorrow from 8 to 2. Tell us what's going to be going on tomorrow.
So 8 to 2 tomorrow, we're going to be having a screening. It's at Sisters of Charity Hospital on Main Street. The Sabres alumni are going to be there to welcome people and take autographs.
Okay.
We're going to be doing cholesterol screening, blood sugar screening, bone density, and then we're also going to be screening for aneurysms and carotid artery disease, which is a leading risk factor for stroke.
Okay, do you need to make a reservation or anything, or you can just come up?
Phone number is 447-6205. Great if you can call, make an appointment. If not, I'm sure we can get you in. There are plenty of spots still available.
Okay, 8 to 2 tomorrow. Thanks for being here today, Dr. Roger Wolcott, and thanks for wearing your Christmas tie, like
Absolutely,
we said.
thanks.
Happy holidays to you, and thanks for this important information.
You bet.
All right.